All right, to form NG irrigation, I would first verify my medical order or the facility policy regarding the frequency, the solution type, and the amount of irrigant. I would gather my equipment, perform hand hygiene, identify my patient by two means, explain the procedure to the patient, provide for privacy, and then I would put on my gloves. Next, I would check the tube placement. If it's an initial, we would check the x-ray, check to see if the patient is in any respiratory distress, or check gastric contents using the pH strip for a 0 to 4. And then after that, I would clamp my NG tube, draw up 30 mLs of saline, and then I would place the tip into the NG tube, and then holding the syringe upright with the tip pointing to the floor, I would slowly insert the saline slowly and evenly. Then I would unclamp. Well, it would be unclamped when I did that, and then I would pull back the aspirated contents. Place it there to measure in a minute. And then, while it's clamped, I would take air and place it into the blue vent. And then I would reconnect my NG tube to suction or clamp it. I would remove my gloves, assist my patient to a position of comfort, and then I would measure the return solution, checking intake and outtake, and then I would perform hand hygiene. I would assess the patient's stomach using a full abdominal assessment, and then I would document the procedure. At this point, if I was going to give my patient tube feeding, I would position them appropriately to a 30 to 45 degree angle, verify the placement of the tube using x-ray placement, respiratory distress, or gastric aspirate pH. And then I would assess the gastric residual, and then I would instill the prescribed tube feeding, and then I would flush the tube with water, and I would then I would clamp the tube appropriately. For the removal of the NG tube, I would first verify my order to remove it, perform hand hygiene, identify my patient by two means, provide for privacy, explain the procedure to the patient. I would do a full abdominal assessment and position my patient to a 30 to 45 degree angle. I would perform hand hygiene and put on my gloves. I would turn off the suction or disconnect the NG tube from the suction. And then I would irrigate it with 20 mLs of air. Then I would remove the tape from the patient's nose or remove it from their gown as well. And then I would tell the patient to take a deep breath and hold. I would then clamp the tubing and then quickly and smoothly remove the nasogastric tube. I would dispose of the tube and the equipment in the appropriate disposal container. I would clean the nares and provide mouth care. I would remove and discard my gloves and perform hand hygiene, and I would document my procedure.